Now, medical researchers say a new heart valve will help some elderly heart patients who can't risk open heart surgery.
Australia is the first country to trial a heart valve which can be fitted and refitted without open heart surgery. The clinical trials have been led by a team from Melbourne's Monash Medical Centre, and the director of Monash Heart, Professor Ian Meredith, joins us now. Good morning. Thanks for being here.
Karina, Michael, thank you for having me.
Explain exactly how this procedure works.
So the aortic valve is the main valve that lets the blood out of the heart, and as you get older some people have that valve narrowed, just like doors being rusted, and the valve doesn't open so blood can't come out of the heart. So traditionally the way we fix that mechanical problem is to open the chest and replace the heart valve. But of course it's a disease that often occurs in very elderly people who are too frail to actually have open heart surgery, and so they languish and develop heart failure. So what we've got in this procedure is a valve that you can come up from the leg via an artery and take the valve into position and then expand the valve when you're in the position in the heart, all done from the leg through a tiny little incision, about 3-4 millimetres.
Sounds amazing. It's less dangerous, obviously, than open heart surgery. Is it in any way less complicated than that?
No, it's actually more complicated in a way because you don't see it. So you have a large screen and you are watching it by X-ray. You're not actually watching the valve live in the chest. But the great benefit of the procedure is that you can actually reposition the valve. If you don't get it exactly right, you can move it a little bit and get it into the exact right position.
Right.
Of course,
essentially keep going back in until you get it right.
Yeah, exactly, because it's connected to a large lead outside the body, so you have cable controls, if you like, to outside your body. So we did the first 11 procedures in the world, and all of those patients are up and walking within hours of the procedure, which is a major heart valve replacement.
And I think we can just see some footage of the procedure now.
That's right.
How revolutionary has this been?
Oh, this is an amazing revolution, in that it's the first of many heart valves that are going to be replaced this way. And there's the valve you can see now in position across the aortic valve, and that's a traditional sort of X-ray image that we see, and we're doing it by not seeing the patient directly, but by looking at these images on the screen and seeing the heart valve be placed in position. And these are the sort of techniques we use to position the valve. The great beauty of this, though, is that you can actually reposition it and make sure that you get the valve in the exact right position.
And how are those 11 patients now?
Brilliant. So they've just passed the 30-day. We did the world's first in-man trial, and or first in-human trial, I should say, and that trial looks at the results to 30 days, and we're just about to launch a global human study across Europe, US and Australia.
It's amazing.
Professor Ian Meredith, thank you.
Thank you very much for having me.
All the best with it.
Thank you.